Leveraging technology, data and communication. Mah-sere Keita, Director of Programs, African Society for Laboratory Medicine, talked about the first of its kind online policy tool that offers an overview of the status of healthcare across countries of Africa, called the Sustainability Index.
It identifies some of the key drivers that affect the capacity of health systems to cope with system-level strain and ensure that they are resilient in the face of major challenges. So in order to develop the index, the program included a panel of healthcare experts from Africa, and we oversaw the design of the index and guided the process to ensure that the focus areas were on current and future health interventions.
How sustainable is healthcare in Africa?
At the moment, it's a little bit difficult to say that the healthcare systems are sustainable in Africa because we're dealing with countries and regions that are typically resource poor. The healthcare facilities are often lacking in equipment and in human capacity. In terms of being able to reach out to communities, we have an issue with access to healthcare services for many communities and many locals.
But when you look at the region, for instance, where do we see most of these challenges more than other regions?
The areas that are the most challenged on the continent typically are Central and Western Africa. The regions that are doing relatively better are the Northern African and Southern African regions, as well as East Africa.
When you look at the region, for instance, where do we see most of these challenges more than other regions?
The areas that are the most challenged on the continent typically are Central and Western Africa. The regions that are doing relatively better are the Northern African and Southern African regions, as well as East Africa. Some of the lessons learned from these pandemics, we've learned that sensitization and communication campaigns fully adapted to the local context are critical. We've learned that prevention is much better than treatment. We need to really work on the area of prevention and ensure that the disease is controlled and doesn't spread wide, because treatment is an issue. Our health facilities are strained when the pandemic becomes out of control. And then we learned that contact tracing is an essential intervention during pandemics. So to be able to trace the contacts of those who have the disease.